Good morning, and thank you for attending this workshop on COVID data intelligence. My name is Margaret Piliere, and I'm with CGI. We're a global IT solutions and business consulting company. We've also been a partner to the state of New Jersey and counties and cities in New Jersey for over 30 years, as well as being a partner with the New Jersey Big Data Alliance. As everyone knows, this past year has been unprecedented in so many ways. And though it has been heartbreaking and really difficult for everyone, in many ways, it's spurred innovative ideas around how to make hard decisions during a disaster. This workshop will explore new and creative ways to track mobility data to not only help us determine how to deal with crises now, but also to predict what will happen next, allowing us to make decisions about the future. Additionally, it is extremely important we understand the impact of these decisions on disadvantaged communities in our urban centers so that we can ensure our decisions are addressing the needs of every resident. So with that being said, first, I'd like to introduce you to our team at CGI and Camber Systems. Steve Emanuel and Madhu, Sreekumuran, Nair are with CGI and Navin, Vembar with Camber. They're going to be giving an overview of our COVID data intelligence program, which is currently being used in New Jersey. And then next, we'll hear from Dr. George Avirappattu, Associate Professor at Kean University. He runs the Center for Data Analytics there, and he's going to give an overview of their data intelligence program and how they're using it to track important social and economic data during the pandemic. So for now, I'm going to turn it over to Dr. A for a short introduction.
I just want to say a few words about our partnership between CGI and the Center for Data Analytics at the Kean University. Welcome to our workshop. Both businesses and academic communities are trying very hard to help deal with the emergent all hands-on situation we have with the pandemic. And we here have an example of a partnership between industry and academia, as we have between CGI and the Center for Data Analytics at Kean. CGI advises state and local governments manage their efforts mediating COVID-19. Kean University, in partnership with other academics, trying to understand how different communities are impacted differently by COVID-19. We are coordinating our efforts to develop a pipeline of students skilled in data analytics while channeling academic resources into industry. Having said that, now we'll pass the mic on to Steve. He will get started with the workshop. Thank you.
Thank you, Dr. A. So I wanted to take an opportunity to kind of share the story behind how this program came to be. In the summer of 2020, working at CGI, I was actually monitoring a lot of what was going on as far as what public sector entities were tracking, and it seemed that most of the focus was on testing and the hotspots. And again, none of us really knew what the future held. And I was trying to figure out, what could we do to assist government entities on identifying other things that would be coming out of the pandemic. And again, none of us really knew what the future held. We began to see spikes in cases after the summer. It started going down, and then we saw the spike going up again. We saw the growth of testing and testing locations. We were already questioning what was happening about school openings in September. And we were also looking at the vaccine development, but the time frame was still very unknown. So we knew that there might be ways to use data from a myriad of sources to help government leaders make decisions, and all based on analytics. So looking back, I wanted to share what I had learned or incorporate what I had learned from other pandemics, whereas the IT leader, I was called upon to help business leaders and business continuity planning. My first event of a similar nature was the SARS outbreak in 2003. And fortunately, there were no recorded deaths in the US, but there were about 750 worldwide. And at the time, we knew that should an outbreak flourish, our nationwide network of resources would be compromised, as well as the transit system. But again, in 2009, with the H1N1, the swine flu, there were about 18,000 deaths in the US. And when this pandemic hit, I was the CIO of Montgomery County, Maryland. And again, we had to find a way to leverage data to simply report the impacts, but we didn't really have the right tools with the predictability capabilities or the trending capabilities that would assist the county leadership to make database decisions. So what came to mind was what's up on the slide now. We knew that, with the pandemic and how fast it came across the globe, there was just way too much information, way too fast. And, given, government resources and the challenges with funding, we knew that a lot of this was going to create problems for government IT organizations to try and figure out how to put this kind of information in the hands of their leaders. But we also knew that government leaders had needs. We knew that they needed to be able to trust information. We knew that they wanted to, share their precautions and successes and trends with their citizens. And we knew that they wanted to be able to make better decisions based on data and provide sustainable and quick solutions. So to that end, I was kind of intrigued by a prototype presentation that was shared with me that used data analytics to show positivity rates, but combined that with testing and hospital analytics. And more important, and what I thought was the game changer, was adding human mobility to help demonstrate these visualizations. How people moved, where they moved to, how long they stayed in some locations, and how would that intelligence help government leaders to maybe identify locations of test sites? Where were they putting these test sites? As a first responder in my own community, I looked at where people were being rushed to hospitals and how to balance hospital loads, where to support vaccination sites and maybe where they should be situated. I mean, vaccination sites sprung up, all over in many cities, but how could we help use data to proactively support where those were going? So, we knew that that the CDC was releasing data. We knew we wanted to solve this business problem of how to help government officials use data to make their next step decisions. I was in the city of Newark when a lot of this, began, and the Mayor Baraka was very, very clear on. I want to be able to say, how can I make predictions? How can I use data? How can we show trends to really demonstrate the value of what the government is doing in order to protect citizens, as well as the curtailing the spread of the virus? And Dr. Goldstein also supported this strategy in his discussion. So in October 2020, we met and developed a partnership with our co-presenter, Camber Systems. Camber had begun the arduous process of identifying data that could help broaden the ability to analyze the spread of COVID and the impact of COVID, and help use data to better understand of what was going on with the pandemic. So utilizing that, we were looking for information from the CDC. We wanted to showcase the scope of data that was available to government and to add elements of the people movement to help with the trending and potentially show some predictive analysis. And one of the charts that I happened to see in my early stages was a predictive analysis that was done by Camber for the state of New York. And it actually was entitled the Be in School Movement. And it was about how they could use data to look at infection rates and look at case studies and look at those trends to help predict when schools could open. Margie, can you go to the next slide? So we wanted to help deliver a solution for this pandemic and be a partner with our government entities. So we wanted to help them create models to use both national and local data. Many cities and counties and jurisdictions had started collecting data, but did they actually have the ability to compare that data to national trends and national data? So that was a good component of what we wanted to do there. We wanted to make sure that it was about illustration of the impacts of the pandemic. As Dr. Goldstein mentioned, visualizing this and visualizing what message you wanted to send was crucially important to the people that needed to absorb it and understand what government was doing. So we started looking at hospital impacts. We started looking at local cases. We started looking at other observations about people movement and hotspots and the trends that you could see based on some of the GIS information that was already being established in the local government entities. We wanted to identify for government a way to have citizen communications on these trends and help them focus on the fact that government wanted to be transparent about what they were doing. We wanted to make sure that the statistics were relevant. We wanted to give them current statistics. We wanted to help with reliable trending. And all this artificial intelligence really needed to come out of the new tools that are out there. And we wanted to try and help make these tools available. So we created a trusted environment. We created the ability for enterprises to look at this option as data-driven decision-making. And we wanted to continue the joint research on the data needs, the visualization development, the tools that were there, and support just-in-time information challenges using the data and mobility, focusing initially on the pandemic, but looking at all of these elements as to how we could do things for other events, such as environmental impacts and environmental events, heat and cold emergencies. We know that every city and every county deals with homelessness. How can we utilize mobility and some of these data trends, both the national trends and local trends, to help with homelessness decisions? We know that every city and every entity is struggling with economic development or recovery in some cases. How could we utilize mobility to assist with economic development? And we all know about road and traffic challenges, and we believe that this was another opportunity to showcase how we could use mobility and very, very solid data sources in order to create opportunities for those that were looking at innovation in traffic management, looking at development, looking at road closures, looking at traffic conditions. How can we leverage all of this from an informational perspective, and also with a long-term solution, looking at this data over long periods of time, really help understand how you could come up with predictive analysis based on years, hopefully, of having this data available. So this is how we came up with our idea for the COVID Data Intelligence Program. The objective, again, was to help government officials answer questions to citizens with data and showcase the ability to let data trends be a guide for the safe and health of each community. So with that, the next stepping point is I'd like to introduce you to Navin Vembar, our partner from Camber Systems, to showcase how their model came to be and demonstrate their strong partnership with CGI. Navin, it's all yours.
Thanks, Steve. We're going to talk through just a couple slides here. The first is actually a conversation about some data that's out there around ICU capacity and demonstrating at the local level how potentially you might want to reallocate resources. You know, where actually there might be concerns. You can see here, this is actually these are actually two charts about ICU capacity and the percentage of those people in the ICU with COVID from a few months ago, and you can see these dramatic spikes that you know, I think we're all aware of. Were sort of hitting us towards the end of last year. This is all, by the way, based off of HHS CDC data that we were able to pull from those public data sources, but then also coalesce into something that was useful to the locality here, right? This is, you know, we spent time sort of understanding what this data was telling us, you know, doing the cleansing, and then came out here with basically some top level takeaways that could be used to help understand and make decisions at the local level. These are great, especially when you start putting them in context with the next slide, where we are talking about, if we can go forward, where we start talking about mobility. And I'll get a little bit more into detail with that. Can we go to the next slide? Who's got control? Thank you. So this is only one example of many metrics that we have. So let's talk a little bit about mobility data real fast. So we at Camber Systems purchase commercially available data from cell phones that tell us about how people are moving. Camber, myself, worked with Harvard, Princeton, and other epidemiologists to design metrics that were actually useful when coming out of these cell phones for epidemiological purposes. We also spent a lot of time in collaboration with those same teams in designing privacy measures around this that actually keep individual privacy safe while still providing aggregate information. That's actually, we use what's called the gold standard of privacy or data aggregation privacy called differential privacy. A lot of, the census right now and Apple and Facebook are sort of the largest users of that. We applied the same science to actually to ensure that our mobility metrics met those same requirements. Here, what we actually have is as I said, one example of many metrics that we have that tells us where we see hotspots for zip codes in Middlesex County of people leaving that zip code to go to other zip codes over the course of a day. What this tells us is where traffic is going to, and vice versa. There we also have inbound movement where traffic is coming from. Especially as we see spikes, understanding if people are going to or coming from areas where there's higher risk and thus can be importing risk is something to be very conscious of, and especially as if you're a county manager or looking to provide services to people, you have a way of targeting potentially where those services are based on either heightened risk or potentially even finding ways to reduce that risk if you understand why that's happening. There are, like I said, there are a number of other metrics. An example of other metrics that we were using when we were trying to understand the spread of the disease, especially during early COVID spread, are metrics around for what's called entropy, for example. So entropy tells us how frequently, how unpredictable people's movement is, and thus how often they might be encountering people that they don't know on a regular basis. That was again one of those epidemiologically designed metrics that was useful to help in context with other metrics really start understanding where we might see risk. So all of this feeds into the larger models of both epidemiological models as well as other predictive models, but there's of course also other uses for this information. But this gives you a sense of sort of the scientific basis, the privacy basis, and the utility of this kind of data. With that, I'm going to hand it over to Madhu to explore some of the interactive elements of this data set.
Thank you, Navin. Morning, everyone. So for this particular segment, I'm just going to share some visualizations, which we've developed with this data that Navin's team has been purchasing. So let me start by sharing my screen. So we are going to be looking at two sets of data. One is the movement data, and the other is the hospitalization data. And we're going to look at what kind of insights can be generated using this data. What you're seeing right now on the screen is a chart which tracks movement at zip code level. We can visualize this data at the nation level, state level, zip code level, and go down to the tract level, census tract level as well. But for this discussion, I'm going to start with the zip code level. So we started by looking at which zip codes have the highest amount of movement, both inward and outward movement. And we broke it down to a single week. And you can see that for each of these zip codes, we have some metrics which track the movement. If you look at this particular zip code, you can see that this particular zip code has had the highest movement over the course of the weeks. What this would help you understand is to compare this with the case counts and look at whether the movement is directly correlating to the increase or decrease in the case count. Just to go down one more step deeper, we could represent this on a map with breaking it down to inward and outward movement. Where are people coming in from? And start representing it on a map. Where this would be helpful is to look at whether people are actually moving in from a containment zone, an area where there's high infections right now. And if you particularly highlight this particular zip code that we've been looking at, we can break this down into 4-hour segments based on the movement of people. And you can see that for this particular zip code, there has been movement from the surrounding areas. So even though there is higher movement, people are actually moving in from closer zip codes, and they may not be coming in from a containment zone unless this particular zip code is a containment zone. You can break it down by different activity days and start visualizing it. And this can be extrapolated to the whole nation. This is another example of where people are moving in from. This is just a more granular level. It gives you the magnitude as well. I also want to go down to the outward movement. So it's not just, so we started with the total movement, we broke it down to inward movement, and now we're looking at outward movement. Where are people moving to? Is there a possibility of people moving into containment zones and areas where the infections are high? You can select a particular zip code and look at whether someone is moving to, let's say, New York City, where at a particular point, if there was high movement, you want to see where exactly are they moving to. So you could filter the zip code and start looking at that as well. Another very important metric that would be helpful to people is to understand which blocks of time is the movement high. So for instance, when this pandemic started, one of the things that was instituted was to make sure that seniors are protected and they get a time slot which is safe for them to shop or safe for them to move. And if you look at this, this would give an indication of when the movement is really, really high, and policymakers can start instituting policies which can help people move in at the time when there is lower movement within the city. What we've seen is during the weekends, this changes when opposed to the weekdays. So this particular visualization just talks about the zip code movement. I also want to call upon another detail, which is the tract level data. Now for the tract level data, what we see is, this is just representing it at census tract level. We came up with a metric called as tract movement by area, because each census tract is defined by area and population. So the more this ratio, the higher the ratio, the higher the movement in that particular area, and the higher the movement in a lower area. So you can actually go down deeper into the map and find out what exactly is happening. This is an example of people moving around park areas, because what we saw is when COVID started, people started doing more outdoor activities as opposed to indoor activities. And you can directly correlate that there's higher movement in those areas. And what Camber's data has also enabled us to do is they're running predictions. So we are able to predict transitions or movements, and we are able to compare that with the current movement. So if you take this particular chart, it compares the week of Jan 31st to Feb 8th. And then this is the prediction for the next week. We could also represent this on a chart, and what this will help is to help improve the model as well. If you look at this particular chart, you can select a single zip code or a single tract and start tracking as to what is going to happen to that particular tract in the next few weeks or in the next few days. So you can see that this particular tract, this is the current movement, and this is the prediction, and we can see that there's definitely predicted as this is going to be a high movement tract in the following weeks that are going to come. So this is a zip code movement, and I know Navin also touched upon concepts of entropy and dwell count that can also be represented on some of the charts. As you can see, this is basically an entropy representation by zip code. This is a dwell count by zip code. What this helps us to understand is we can see whether people are moving randomly or are they staying in one particular place. And also you can track the devices at the zip code level. All of this data is aggregated. So all you can find out is just the magnitude of movement and the magnitude of the devices. There's no way you can personally identify information about people, the actual people, or the type of people who are moving in and out. So this was the movement part of it. There are a lot more use cases for this, but in the interest of time, I'm just focusing on these particular areas. Another set of charts, which I think Steve talked about, was the hospitalization data. For someone who is an EMT or for someone who's a policymaker in the health department, how do you determine where do you take patients to? Like, do I take them to a hospital which is heavily occupied, or do I take them to a hospital which has capacity? So this particular chart helps you visualize of 100 COVID cases as an example, where are the cases broken down by? Like, for instance, you can see that this particular hospital has higher percentage of cases for the week of February 12th, as opposed to maybe a East Orange hospital. And then we can break it down further by looking at a particular, so this is for Essex County. You can see some of the hospitals in Essex County. We've represented that on a chart, and we've added the average occupancy and average IC occupancy. And if you go back to August or maybe around July, you can see the threshold that we have defined here is 75%, and most of the hospitals were spiking above the 75%. And what this threshold helps us do is to understand whether you need to impose a lockdown, you need to staff hospitals more, you need capacity increased in some of the hospitals. All of those decisions can be taken by looking at this threshold. If your threshold is low, then you can increase it and start looking at it. Or if your threshold is high, then you can decrease it as well. And you can go down further to see how is ICU occupancy managed at a more granular level. And you can see that around August, we were hammered. The hospitals were really struggling to keep up with the amount of cases that were coming in. And this is similar to the chart that Navin did. And this is a representation of how the trend has been in ICU occupancy over the timeline. We can shift this to understand how the movement is, how the cases are affecting the ICU occupancy as well. Another chart that we wanted to make sure is not just the ICU occupancy, but the overall occupancy as well. While COVID was happening, there are also other people trying to visit hospitals. We wanted to see if there is hospital occupancy is also something that can be tracked. So this is an example of the hospital occupancy. I know one of the key concepts that we are all aware of and we want to be ensured of is the fact that the data that we are using is reliable. So this is an example of the hospital reporting consistency. You can see that during the September-October timeframe, there was less reporting of data, but as we've gone further, the reporting has been consistent. And if we see anomalies, we can directly correlate it to these anomalies and start looking at where the anomalies and try to understand what exactly is happening in these hospitals that they are not able to report the data. And this is down to the hospital level. We want to see how we can break it down to the average occupancy. We can compare it with the total capacity of the hospitals and generate trends. And you can do statistical analysis on this to understand what factors are contributing to the increase or decrease in ICU occupancy. When some of the major events happened, like for example, when St. Patrick's Day happened, we saw a spike in some of the hospitals because people were moving more and people were getting admitted more. So this is just some of the examples. As I said, this is just a minuscule set of use cases that we could do, but there are a lot more use cases which can be developed for the data that's being provided through Camber. So this is just the hospitalization data. Now we are starting to look at vaccination data, where to set up vaccinations based on movements, as well as where people are staying, and how to support hospitals and EMT technicians to really take people to the hospitals where they can immediately get care. So all of this is something that's an example of public and private partnership. And this is something that I want to see is being adopted more and more in other areas as well. Back to you, Margie.
Yes, thank you, Madhu. There was one quick question specific for you that I thought maybe we could talk about right now before we jump into Dr. A's presentation. Sure. What data sources and tools did you use for your integration and analysis? Was the DQ a big issue?
So I think the data quality, let me start by addressing the data quality issues. So for the data quality, we had some tools in place which helped us track for example, for this hospitalization data, we were able to track down as to which hospitals were reporting and which hospitals were not reporting the data. CDC, this is all CDC data that's coming in, and it's being fed through Navin's team's pipeline. We built a pipeline between the HHS and Camber is publishing this data out to be able to be consumed by states and local governments. Now, with respect to the tools, what we used was for this visualization, we used Tableau, but it is not, Tableau is just one of the tools. You can represent this in Power BI or any other tool that's available. The key is the data itself, and that's being provided by Navin's team. I would let Navin answer the data quality question for the mobility data and transfer it over to Navin.
Thank you. So in terms of the data quality, so we actually have spent a lot of time with very large companies that basically their entire business, is built on understanding how this mobility data works, and spend a lot of time learning that. We process about nearly a terabyte of data a day, down to useful information, which means that in that processing, we do the work of tossing out a lot of points that are nonsensical, that don't meet our quality standards before we use them. So that is actually a result of a lot of study, a lot of commercial collaboration, a lot of mobility science that actually comes into play, to make sure that we actually have sensical information. And on top of that, in the collaborations that we've had with the researchers and the scientists from other organizations whose interest was epidemiological, which means that they were really there to make sure that we had accurate information, they did comparisons of our data and our inputs with other first-party data sets, right? So first-party data sets being those data sets where the people consuming it or the people using it have full control of exactly how that data is produced, right? Generally, those are the highest quality data sets. But what they found was we actually met, we moved in exactly the same way that those first-party data sets did, and had, similar representativeness, and potentially even better representativeness in certain areas of the country. So that's, in fact, a lot of what the work that we've done really brings to the table.
And to add to that, a lot of this data has been married to the census data, the data from the Census Bureau as well, to represent it on the maps and tract information, population information, all of that comes from the census data as well.
Right.
And one other element that people should be aware of, we developed this program so it was not focused on specific geographies. This information is developed so that any of the geographies, nationally or locally, can be used. I mean, there are many entities that have sister city concepts, and you might want to do comparisons between sister cities, sister organizations, as well as to the states, as well as the counties. So there is no inhibition with the program for our users and subscribers to actually utilize the data for their own localities, as well as looking at and comparing other localities that are of interest to them, as well as the national, and in some cases global. So again, that's how we developed this, so that it was not restrictive. It was really as large or as small as our subscribers really wanted to utilize these. And we are, obviously, need to help them with some of the tools that they're utilizing. So with that, Margie, let's turn it over to Dr. A.
Yes, thanks so much. And thanks to the Camber and CGI team for a great session. Now moving on to introduce Dr. George Avirappattu, Associate Professor at Kean University, who will give an overview of how his team has been working with COVID data intelligence in really looking at social and economic data during the pandemic. So Dr. Avirappattu, thank you.
Thank you, Margie. And thank you, CGI team, a fabulous work that you're doing. And you are helping folks with the logistic on a day-to-day operations. And as we are moving into this second stage of the workshop, I will be showing things more like looking in the back mirror, not a day-to-day operations from a academic point of view. Okay, so having said that, Neil, would I be able to share my screen, Neil, or whoever?
Yes, you should be able to share your screen.
Okay, so can you all see my screen?
Yes.
Okay, beautiful. There we go. All right, let me put it in a presentation mode. Yeah. Okay.
Perfect.
Fabulous. All right, so we just started what is called the Center for Data Analytics under the School of Mathematical Sciences here at Kean University. And as we were listening to Dr. Goldsmith this morning, visualization is so important for everyone to understand, how they're faring their own neighborhood, also elsewhere. And this is exactly what we are doing. If you go onto this link there, you will see quite a few maps we have developed. We are still working on getting a comprehensive set of visualization all over United States. So I encourage you to do that. So let's move on. I will present some of the visualizations today. Unlike the folks presented earlier, I will have more slides and less talk. Okay, so just be warned. So we are going to take a look at the varying impact of COVID-19 among different communities. And we're going to take a closer look at the socioeconomic and structural factors and its impact on the COVID-19. And when I say different communities, there are so many ways to figure out communities, but for a logistic easiness, we used zip codes for breaking up communities. Okay. First, I want to take a moment to acknowledge some of the folks who are involved in this work. Of course, we just started a partnership with the CGI. I want to acknowledge them. But I have started this work. I started working with the Division of Population Health at New York University a couple of years ago. But once the COVID came in, we started looking more at COVID-related data as far as population health goes. And so my work is in coordination with New York University. I want to acknowledge the folks there working with me. Center of Data Analytics at Kean. Many of the students and faculty helped me quite a bit, especially the students collecting data. It's a massive effort to get the data from every state. We don't have data from all the data from every state, COVID data from every state, but I couldn't have done without their help, the students and faculty. And I also want to acknowledge our work is partially supported by a seed grant from Kean University. Okay, so now let's take a look at what is to come. Okay, so our overall objective is to understanding community vulnerabilities, to assist those who are in charge to develop data-backed intervention and prevention strategies in a future pandemic or natural disaster situation. Okay, so in doing so, we first look at social vulnerability index, a composite measure created by CDC as a proxy to measure socioeconomic and structural factors. And then we look at the association between social vulnerability index and the impact of COVID-19 measured in terms of mortality rates and positive case rates in each of the zip codes. And later on, we will engage broader measures than SVI and use powerful machine learning tools to take a deeper look at the association between social and structural factors and its impact on COVID-19. So at the end, we will have attempt to identify the communities as well as the elements in their profile that makes them more vulnerable. Okay, so take a look at the more recent status. You probably are all pretty aware of this. As of April 23rd, in US, we have about 32 million cases and over 500,000 deaths. And the bar chart kind of summarizes which states leads in the case rates and the death rates. And you probably can see California tops the list, and then Texas and New York in turn in terms of case rates and death rates, as well as a summary at the global stage, about close to 150 million infected, over 3 million deaths. Incidentally, the global data also lists the recovered counts, And the bar charts again list the top countries in terms of case and death rates, and you can see both US tops the list. Moving on. So we are trying to understand COVID infection death rates among different communities, and in the media as well as in the literature, there is a perceived disparity among communities in the US. And so what we are trying to probe is, as attributed to oftentimes in the press, is it due to race? Is it due to socioeconomics? Used to or due to crowding or whatnot, or are they, as we thought earlier on, just clinical factors such as obesity, respiratory condition, and whatnot? Is that what drives the case rates and mortality rates in communities? So our efforts will solely be focused on the socio-economics and structural factors, no clinical factors involved here. So let me just tell you ahead of time. So social vulnerability, we're going to use as a proxy to measure social vulnerability index that's created by CDC. And it comes from as a composite of 4 domains: socioeconomic status, household composition and disability, minority status and language, housing and transportation. And each of those domains are derived from several factors. Like, as you can see on the right side, there are actually 15 of them grouped into these 4 domains. And the social vulnerability index is a composite of all those 4 domain indices. Okay, here is a macro view of social vulnerability all across the United States according to zip codes. And so here is a map. It gives you an overall picture, and you can see that Southeast and South Central United States are more vulnerable. A dynamic map that you can zoom into will be made available at our website. We have them. We decided to get it all figured out. The maps are really huge, so you can look at your own neighborhood and see what is going on there. For New Jersey, we have a dynamic map there already. So let's move on. New York is one of the places we have zip code based data on mortality rates and case rates made available earliest. So we focused our efforts first on New York, and what we have here is 160 or so zip codes of New York among the 5 boroughs. And the coloring here is more vulnerable or darker red. And you can see the areas, if you're familiar with the New York, Queens, actually Bronx, the top here, Brooklyn and Queens, those zip codes are more vulnerable. And the dots, the grayish dots, the size of dots indicate the mortality rates in each of those zip codes. And it's a pretty easy to associate. The higher the vulnerability, the larger the dots are. And for example, over here in Staten Island or in the middle of Manhattan, less vulnerable, and the rates are pretty low. So the social vulnerability has a clear association with the mortality rates. So what we found in New York, we just dug a little deeper to get a correlation. And as you can see here, now we have both mortality rates on the right side and the case rates on the left side. And they are roughly about pretty good positive correlation. And the correlation coefficient, if you're statistically inclined, is about 0.6, and that shows really strong correlation. By the way, this data is from about November. We have updates, but to get the idea across, it didn't really matter to a certain extent. So we expanded our investigation into Chicago also, as a data was made available by the city of Chicago. And basically the same story. The mortality rates are pretty well associated, a positive correlation to social vulnerability index. As far as case rates go, when you combine New York and Chicago, the correlation is a little less. Actually, there is a very good story behind this. It turns out, as as we went on, like for example, late in the pandemic, like February and March, this correlation dissipated quite a bit, in the sense that the COVID was spreading everywhere. And so the protection, if there was any, because of socioeconomic and structural factors, kind of dissipated, because everybody is vulnerable. You know, if you let the pandemic sit around, that's basically the story. In fact, our students from center have a poster. That's again discussion for another topic. Really explaining what happens in the association as time passes, focused on Chicago. Okay, so we expanded our work as we had more data available. In fact, now we have data on mortality rates completely from five states, and we have case rates based on zip code from about 15 states, and we have put it on our website. Here is a dynamic map we can take a look at. We have New Jersey. New Jersey is a little different from the other states in that we don't have data available on all zip codes. We only have about 170 zip codes that are more populated. For privacy reasons, the government doesn't make the data available on all zip codes. So let's take a look. So these maps contains a lot of data, so it takes a little while to load, so bear with me. So here we have every zip code of New Jersey colored according to social vulnerability, and you probably can see that the zip codes in more urban areas like Newark and Patterson and Trenton and Camden and some of the rural areas are highly vulnerable, as you see more reddish regions. And if you take a look at the COVID case rate, the circles again, the size indicates the rates, and you see that the more socially vulnerable areas are hit harder as far as the infection rates go. And if you take that away and take a look at the death rates, basically the same story emerges. The more vulnerable population are hit harder. By the way, in this map, you can actually click and find your own zip code and see how you fare in all this. So this is all available at our center's website, and feel free to peruse at all kinds of information that's available there. All right, so let's move on back to the presentation. Let's see here. Close this thing. Yes. Okay. Is this? We have a bunch of other states here, and I'm not going to go through all the states. As North Carolina is pretty similar. The good thing about North Carolina, every zip code is available, but you will see the same kind of pattern. In the interest of time, I'll keep going. Oklahoma is another state. We have all the data available. South Carolina, I just want to mention something about South Carolina. South Carolina, of course, I had to go through all the formalities getting data, but they shared their data with me. And I work pretty closely with the state health department. They found our work very useful. In fact, they have been in touch with me. They told me right before the vaccinations started they would like to use our findings to guide their vaccination policy. So that was very impressive, and they were very thankful partnering with us. A quick look at South Carolina. This map is actually from a little while ago, created with a slightly different platform. So you see the coloring is a little different, but still the reddish regions are more vulnerable. One of the interesting things I want to point out, I had never known unless, the first thing they said when they looked at this map, said, look at that I-95 corridor. And that's what you see, this reddish area here from north to south, I-94 corridor. So until you get to, local situation, you don't know what intrinsic, stuff is there. So it's very immediately they pointed out 95 corridor, and they would want to focus their intervention efforts on that corridor. So anyway, going back to our slides here, let me see. I'll close this also. Okay, so the state level data, we have all this available. Now for the later part, we're going to focus on certain zip codes just to get the idea across. The zip codes from New Jersey, New York, and Chicago, that's what we're going to focus on our analysis. Those zip codes are in many ways have a lot in common. Although New Jersey is a state, we only have 160 or so zip codes, more urban areas that are very similar to the city of Chicago and New York. So that's what you will see for the rest of the work. Okay, so here is a sort of a scatter plot separating New York, Chicago, and New Jersey, the correlation between social vulnerability index and case rates. And you see that pretty well correlated and a positive correlation. And here are the death rates for these three regions. And you see again are positively correlated. In New York, little more positively correlated than the other locations. And now we're going to start our dependency on social vulnerability index, because the social vulnerability index, there are some deficiencies there in that it only looks at limited number of factors. Those are just those 15 we saw. And the social vulnerability index was really created to study the aftermath of Hurricane Katrina. So although, hurricane is one thing, it was more focused on Louisiana area and whatnot. The pandemic is a different, different beast. And so we wanted to try to work in perhaps more interesting factors. The other thing is SVI, the Social Vulnerability Index, is created for census tracts. And mapping from census tracts to zip codes, it's not exactly perfect. So some of the experts looked at our work, said you got to be very careful going from census tract to zip codes. So we kind of stopped looking at SVI. Instead, we went on to collect data from the 2018 American Community Survey done by the US Census Bureau. And we picked up close to 200 measures on socioeconomic and structural factors from every zip code. That includes educational level, more details than SVI, population by age, household income level, commute time, employment type, whether full-time, part-time, or unemployed, housing type, housing age, and so on and so forth. Lots of different factors, and it was available. So we tried to make use of that instead of the SVI index already created. In our analysis, we employed very powerful modern machine learning methods to extract or get deeper into the complex relationship between social and socioeconomic and structural factors in COVID-19 death rates and zip codes, death rates. in our work here, I'm only showing the death rates, okay? And our objective is to measure the variability in COVID-19 rates from zip code to zip code, explained by these factors, socio-economic and structural factors, and try to get a sense of the relative importance of each of these factors in explaining the impact of COVID-19, okay? So we actually, out of these 200 or so variables, we kind of handpicked 125 that we thought more interesting in this effort. And then we used feature extraction tools in the machine learning feature engineering scenario to just look at 50 of those most explanatory variables. Okay, so we limited our attention to 50 of those. And those are basically, once we used the selection to limit to 50, it came up as a educational level, more detailed than SVI, such as whether high school education or less, or more educated, the commute time, the type of commute, household income, employment type, living environment type, then home values, the vacancies in each zip codes, the reason for the vacancy, then the age of the homes. Okay, so all these factors, you can see, quite a few here. These are, what we do is we take the count in each of the zip codes and create the proportion of, for example, people with a less than high school education, proportion of people in the zip code with just high school education, proportion with the professional degree preparation, and as you see, the race also is a factor. The white count, African American proportion, Asian proportion. Another important factor is single family proportion, single parent family proportion, and whatnot. So out of these 50 variables, okay, we try to see which one of the machine learning methods do the best in trying to explain the impact of these factors in the differences in COVID rates, COVID death rates. And so you probably, most of you, if you do any statistical analysis, familiar with the linear regression, and that actually didn't fare very bad. By the way, we're comparing each of these methods depending on the error rates that this provides, and variations of regression, lasso and ridge didn't fare as well. And if you go down the list, you see that the support vector regression, random forest regressor, gradient boosting regressor, they do actually much better on the error rates. So we used them in our further work. By the way, there is quite a bit involved here. I don't intend to get into any of those details. Just want to try to bring you the results as to how these methods can explain social vulnerability impacts the COVID rates. Okay, so the gradient boosted regressor as a is very typical in the machine learning arena. We set aside certain data to create the models, while a test set is put away. We won't touch that in creating the model. The test set is used to see how well our model is doing. And so here, once we created the machine learning models, our test set, we test the model on, and what you are seeing here is the on these zip codes set away as a set apart for testing. The death rates, the actual death rates, this is, by the way, from November, are indicated by the green curve, and then the dotted red are the numbers predicted by the model. So although it is not exact, you can see that the trend is pretty well captured as the red dotted line tags along the green line. Okay, as to see how well this is doing, we made a scatter plot of the actual rates versus the predicted rates, and you see that they match pretty well. In fact, the correlation, again, if you are statistically inclined, 0.88, and you know that that's a very strong correlation. In fact, the square of this R roughly is the variability explained, which amounts to about, by the way, over 70%. So the 70% of the variability among different zip codes in COVID death rates are explained by these 55 factors alone. So that's really remarkable, because we are not using any clinical factors here at all. It is simply from socioeconomic and structural factors. It can explain 70%, over 70% of the variability, at least in these cities, in the impact of COVID measured according to COVID death rates. So we are finding socioeconomic and structural factors are really the key to understand how different communities are impacted. That's the sort of nutshell version of our finding. Now here is a listing. It's a little bit hard to read because the listing came up, vertical, and it is too long. So I turned it around. The importance of each of these 50 factors as to getting the prediction right. And as you can imagine, and it's a pretty known, in fact, quite a bit of controversy, nursing home proportion. That's the most influential factor in each of the zip codes. Proportion of people in nursing homes dictates mortality rates, followed by unemployment, no work proportion, by commute time, more than greater than 90 minutes, followed by education, and surprisingly, perhaps, people who live in buildings that are built 1940 or actually 1950s. Then using public commute, people who use a public commute, and single parent family rates in there as a pretty important, and so on and so forth. So this is the power of a machine learning. It will tell you which one of the features are more important than others. And the other thing is machine learning allows you to dump in lots of variables compared to regression, where you have to limit to few variables. So we are able to see this. So at the end, what have we learned? So 77% of the variability, as I mentioned earlier, COVID death rates, at least in this region, the variability between zip codes are explained by social and socioeconomic and structural factors alone, and that is significant. And what we are doing is completely data-driven. Now, simple perceptions or anecdotal stuff, totally from data that's published by appropriate agencies, and our models confirms certain factors like nursing homes and all that we suspected. It confirms that, but also reveals some other factors like the commute time, educational level, and whatnot are very important. Hopefully, this will provide tools to decision makers, totally based by data, to perhaps first identify most vulnerable communities, especially going forward, something like this never to happen again, right? And help identify what are these vulnerabilities. So you might find, look into intervention, prevention strategies, and then help understand factors that makes some community more resilient to make preemptive measures before to mediate and insulate communities against future pandemic. Okay, so that's pretty much all I have. I don't know how much time we have here. If some of you want to see some of these great maps we have created, I have some static maps available. I would be glad to stick around and show that to you. But go to our website, and especially in the coming days, with the help of students and faculty, I'm going to populate our website with a comprehensive set of dynamic maps, and that will be made available to you. Okay, thank you again.
And thank you, Dr. Avirappattu. We do have a few questions, and some are for you, Dr. A, and then others are for the other team. But number one, for Dr. A, are there any partnerships with Kean University and any other higher eds to make programs like our CGI program implemented quickly and impactful, and kind of with a thought towards internships?
Great question, Margie. Actually, we saw between CGI and us, our work and our interests are sort of aligned. So it's a natural partnership. We are working on it. We are discussing how we can do better to use our findings, perhaps to enable CGI, because you have more direct interaction with the cities and state governments. So we look forward to doing that. We actually work with partner with NYU, for example. I started doing some work with the Seton Hall, and we look forward to any opportunities to expand our findings and our work. And so this is something we just started the Center for Data Analytics about 6 months ago, and we are very excited seeing plenty of opportunities. We are looking forward to expanding it, and we love to have others from other campuses partner with us. In fact, CGI is one. I am talking to the New Jersey Department of Environmental Protection. We have some work, preliminary work outlined, and looking for all kinds of partnerships. We welcome anybody who wanted to partner with us.
Well, to kind of follow up on that, so we saw a presentation with CGI and Camber's data and how we're using that to inform decisions at cities and counties in New Jersey. And then we have your data, which is very social and economic data that is, that is very informative too. And, what are the ways you see the two coming together and being used together? And I, thinking about your nursing home comments and, vaccination centers and community services, but, what are your thoughts on that?
Well, we are pretty in the early stages. For us, getting direct access to data has been pretty challenging. For example, it worked very well with the South Carolina. I had to go through, filling out lots of forms. It took me 3 months to get that data. New Jersey is still challenging. And it appears that, CGI has, because of your agreement, you have a access or a pipeline to current data, which we don't have. And that's really the bottleneck. So getting this data is, so we have a lot of work, we need to organize, trying to channel, because the public and the government has to understand, we are really trying to help them. And so they should come forward. We are actually volunteering here, trying to find all these things. I mean, with the minimal funding, we're looking for, entities who would help us. But the most important thing is engaging our students. There is a huge talent pool, and they have no clue that there are opportunities. We teach them linear algebra, we teach them all kinds of mathematical tools, and we teach them programming. But that bridge has to be crossed, that these are amazing tools you can put to use, and the companies out there like yours dying to have students who have these skills, right? And this is small bridge, we just have to build it, right? Prepare the students, channel them, and that's what we are really after at this data analytics center. We have the the faculty with all kinds of resources available. We just have to change our mindset, prepare the students, not just in the classroom, but develop skills. And that's what we are after. So I don't know, did I answer that question?
Yeah, no, I think that was great. That was absolutely fine. So now there's a question for Navin Vembar with Camber. How are subscribers notified of new data options for consumption? So how do you know when there's new data available?
So how are data? Yes, okay. All of the data sets that we have. So we have mobility data sets which are delivered on a daily basis. And those are immediately fed over to any subscribers of the data set. But then additionally, the other data sets have published information in their metadata about what the availability timelines. Usually most of the hospital data sets that we've seen are weekly. And so, the orchestration pipelines that have been developed, we'll go pick those up on a weekly basis. So it does take some effort to make sure that the timings are right and other things.
Great, thanks. And there, for the CGI Camber team, how long does a program similar to the one demonstrated take to be created? And is the program premise-based in the cloud or a hybrid? And I don't know if that's Madhu, Navin.
I'll take the potential. So for an organization that is ready to tackle this because it is a priority for information sharing, actually creating the connection and the ability to consume the data can really be done in a very short period of time. And it has actually been done in less than a month. And it will depend on how the subscribing entity wants to absorb and consume that data. So we have multiple models. One of the models is absolutely cloud to cloud. Another model is on-premise and allowing that entity to actually report off of that. Again, part of it is it's dependent on the capabilities, the tools, the resourcing that each entity has in order to take, consume, and then publish that data. And if those resources are lean and there needs to be a business process and some ramp up for both the tools, delivery, and the actual analytics, it'll take a little longer. But we've actually seen a full implementation and transition of the data from the subscription request to actual consumption in less than 30 days. And we've actually seen analytics and visualizations created within the next 30 days that follow along the line. And then again, it depends on the creativity, depends on the business need. Again, we are looking at, and as I tell most of my colleagues, our information about what is needed is only as good as our source, which is why we try and have conversations on a regular basis with our government leaders and their IT folks and their strategists and other directors that are doing things from a business perspective. So, the economic development group, the traffic management group, we want to share how mobility and how some of this data can influence the decisions that they're planning on making by projecting information from historical basis and building those trends. So it depends on how complex they want these analytics done and if they've been done before. One of the benefits of what we've done most recently is every one of the models that Madhu shared with you and the one that Navin shared, those models are already developed. So they're, I don't want to say cookie cutter, but they're easily configurable to be delivered. When you create a new model and you have a new question about a new analytic methodology, that'll take a little bit of time. But this is a very rapid paced process.
Right, and Steve, to point out too that this type of data intelligence, right now COVID data intelligence is really at the forefront, but this type of data intelligence can be used in a lot of different cases for cities and counties, and maybe you could say a word or two about that.
Well, certainly. So I kind of alluded to it. There are a lot of business mission critical issues that government leaders are facing, and they change on a regular basis. So as mentioned, Hurricane Katrina, as Dr. Ray mentioned, Hurricane Katrina had a significant impact. What did we learn from Katrina? Then how did that compare to what we learned from Sandy? What were the comparables? What were the unique elements? And we start looking at that intelligence to start building out how we can say, what is the next impact of the next environmental storm or environmental condition that hits the shore, that hits the Raritan Valley? I mean, I don't think anyone expected the devastation in the Raritan Valley from Superstorm Sandy, but we'd never seen a storm like that, so we didn't have the ability to predict it. What was the impact on communications? I mean, we lost a significant amount of cellular coverage in the state of New Jersey in Superstorm Sandy. And what can we learn on how to prevent that? So can we share that with our public utility folks, our communications folks? There's just so many things that can be answered with the development of the artificial intelligence and the analytics of previous data. But again, we need to have that one-on-one dialogue about what information they would like to be proactive about. And again, the objective here is about being proactive, being predictive, but knowing how to harness the data from the past to begin to create those analytics and those trend lines so that we can actually show what the impact might be. So the next heat wave, so we're coming up with the summer. We saw several heat waves over the last several years. How does the data from people movement, what things were short at the time? Were there food shortages? Were there gas shortages? Were there power spikes, power blackouts? All that information can be consumed so we can actually look at comparing that for the future and putting models out there to say, this is the model if we were to sustain a 100-degree plus time frame for 9 days or 10 days. What do we believe the infrastructure failures would be and where would they be? And again, what did our utilities change over the last 2 to 3 years that would actually change that dynamic and potentially change that prediction?
That's great. Great. Thank you, Steve. I would just open up to the panel. Any other further comments that you may have before we wrap up? And if not, we're ready to wrap. So sounds like we're ready to wrap. So you can see from the presentations in this workshop today that both business and higher ed are focused on using data analytics for predictability. These analytics are being used by government leadership to help them make very important decisions in the face of crises. So we hope you found the workshop very interesting and informative, and that you have a new appreciation for how data intelligence can be used to help cities prepare for disasters. We're a little early wrapping up. You've got about 6 minutes back in your day. The conference is concluded for today, so please feel free to join us tomorrow for another informative day of panels and workshops. And thanks to everyone, to the participants and the attendees. Take care, everyone.